Goeienaand, good evening, fellow South Africans and citizens of the world. And tonight we're actually going to have three guests on our live stream. We're going to have both Marinda and Isaac van Zyl. Isaac will be giving us an update on this complete shambles going on with the Steve Biko Hospital. I'll just let you hear it from Isaac's own words. And the third person that's joining us is Christo. Now, Christo is the 2IC at Buralichion, and he's going to be talking to us about some breaking news regarding the situation in South Africa. So please make sure that you're watching the live stream tonight at 8 p.m. Johannesburg time on this channel, the main Loving Life channel. Now, as we know, Isaac van Zyl was basically pushed out of the public hospital, and thankfully we got him into a private hospital where he's going to have his operation once the public hospital release certain information which is required, but that's happening, I believe. Now, the public health system in South Africa is worse than a joke. It is a complete and utter disgrace. And of course, this couldn't be coming at a worse time when the coronavirus is now just going absolutely rampant, which is what I said way back in March was going to happen, because there is no social distancing in the townships. Do you remember that video that was going viral where they were in the swimming pool and they were going, Corona, 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 and thinking it was a big joke? It's not such a big joke anymore now, is it? Well, let me just tell you what's happening in South Africa, guys, just so you understand how tragic this is. Cabinet's National Command Council will decide whether to introduce Lockdown 2.0 for Gauteng as the country's most populous province explodes with COVID-19 infections. According to doctors and other healthcare workers, the virus has arrived with a winter vengeance, filling up clinics and hospitals faster than expected. MEC Bandile Masuku has previously raised the suggestion of an intermittent lockdown, but ultimately the decision on the lockdown framework is a decision by the National Command Council. The NCC is headed by Cooperative Government Minister Nkosazana Dlamini Zuma, and what a disgrace she is. Anyway, who must make the decision in consultation with Health Ministers Zweli Mkhize, who warned on the 25th of June that Gauteng would become the epicenter of COVID-19. With 15 million people, a runaway epidemic in Gauteng, which includes 3 major cities, could be devastating. The numbers climbed steadily from the 1st of June when country's lockdown was eased to level 3, at which time 80% of the economy restarted. This has meant that Gauteng's masses of people are moving again in search of livelihoods. The lockdown in Gauteng took millions to the brink. And it's quite extraordinary what is going on. The end of the lockdown saw COVID-19 cases climb rapidly, and it has sent people to the doors of the province's clinics and hospitals. The Deputy Director of the Wits Centre for HIV and Reproductive Health Unit, Professor Francois Venter, said that hospitals are getting hammered and oxygen supplies are running low. In its last weekly briefing, the Gauteng government revealed that it's preparing more than 1,500 emergency beds at Chris Hani Baragwanath, the Ashanti Gold Hospital, and the George Mukwari Hospital cluster. The province has 8,302 beds across the public and private sectors, but this capacity is quickly filling up. In addition to the beds, the amount of protective equipment, ventilators and other tools on order displays the magnitude of what is expected in Gauteng over the following weeks. Now, you've got to understand, people who aren't in South Africa, this ANC government couldn't organize a barbecue in a park which has got those little coin-operated barbecues. They couldn't even organize that. So they're completely out of their depth when it comes to trying to cope with what's happening right now in the health department in South Africa, in the public hospitals. And tonight we're going to be talking to one of those people who's been impacted by their incompetence. and that's General Isaac van Zyl. Anyway, let's continue. At a single Gauteng clinic in a day, a health worker noted that 80 people were being treated as persons under investigation for COVID-19. Just about all are diabetic, noted the health worker. Just seen a family of 9, one tested positive, and now all symptomatic. Was seriously considering if we should test them all, starting to have to manage who we test no matter what the guidelines say due to capacity issues. Swab shortages and doctors to swab, nurses refuse to do so. The health worker revealed, this reveals rising issues across Gauteng. Nurses, porters and other auxiliary services staff are scared and do not want to transport or test or even clean, as was revealed in the Eastern Cape. Sometimes this is because of the shortage of PPE safety gear, but also because of increasing stigma attached to the disease. Clinics are referring patients to hospitals, but delays at hospitals are causing a set of domino-like crises because tests are running at such long delays. Patients cannot be discharged, if not positive for COVID-19, or be moved to quarantine facilities or field hospitals. Kekana said there is still space at the Nasrec Isolation and Field Hospital facility, which was completed months ago. But many beds are not oxygenated. They do not have piped oxygen capability. This is essential. We are fighting for Nasrec to provide oxygenated beds as hospitals fill up, often with stable patients that just need a bit of oxygen and monitoring so the sicker ones can get into hospital. By the 25th of June, there were 99 cases at Nasrec, but Kekana, who added that the department was working flat out to ensure the availability of oxygen supply and oxygen points in the ward. At a district hospital in Gauteng, a doctor wrote, "My friends and colleagues working in internal medicine are completely overwhelmed and understaffed, and other departments have apparently not sent help. Perhaps their departments are overwhelmed as well. We today have no linen to operate, and our nurses are striking due to the unpreparedness of the hospitals. We have no information about the current disaster plan, and I'm sure we're in a current disaster." He went on to say, "It disheartens me to hear that my nursing and doctor colleagues are also refusing across the board to be in a COVID team. Perhaps I'm silly and should rather think selfishly." Gauteng is heading towards its peak of COVID-19 infections, but health workers are neither being kept in the loop nor well supported, said Venter. The decades of mismanagement in the Gauteng Department of Health are coming home to roost, though Venter says Masuku is doing an admirable job in near impossible circumstances. Venter says the Gauteng Frontline now needs rapid stock-out reports for drugs, PPE, ARVs and other drugs, clear and fast messaging and referral processes, testing focused on hospitals and healthcare workers. Almost 1,000 had been infected in Gauteng by June the 25th, and daily assessments of where we are in terms of hospital beds. Now, amidst all this madness, let's just get this clear. Steve Biko Hospital have been refusing to release critically important information that they've got on General Isaac van Zyl. And there is a development there, and I'm going to wait till tonight on the live stream to tell you what it is. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.